Okay then, I'm gonna teach you some things. This is your standard operating room, anesthesia machine. This back here is what's called a pyxis. It's where I have all my drugs. Laryngeal mask airway, also known as an LMA. Endotracheal tube, also known as an ET tube. If we require one of those, I then hook it up to this, which connects to my machine and my ventilator. Ventilator settings there, your vital signs there. I can choose different anesthetic gases to plug into this little cassette here, and I will deliver those to you. Calm down, Susan. Not every anesthetic do you have something put down your throat like that. Depends on the surgery, depends on the type of surgery, depends on the surgeon, depends on your comorbidities. Along with what the surgeon needs, then we come up with the plan, your anesthetic plan. That's why my job is fun. Every case could be the same exact surgery, but I would do a different anesthetic based on the type of patient, age, comorbidities, weight, height, past history, all kinds of things. Keeps me on my toes. I'm on my dinner break. I'm an extremely classy individual. Like many jobs, depending on where you work, would depend on the type of day that you have as a nurse anesthetist. If you're at a trauma hospital versus a community hospital versus a surgery center, a plastic surgery's office. I've worked a few different places and every single place is different. My days are vastly different. So when someone asks me what's the day in the life of a nurse anesthetist, I'm like, well, depends on what job I'm at. Say my favorite skills are putting in central lines, and epidurals, and just kidding, I love everything. Depending on the hospital, depending on the state, nurse anesthetists are utilized differently. This particular job, I do epidurals, and I stay overnight. My last job, I didn't stay overnight and didn't do night shifts. I was a different stage of life then, and I didn't want to be overnight. Now I do these longer shifts here at this hospital because it actually allows me to have more time at home altogether with Oliver. Now the scheduled surgeries are done for the day. I am on call through till next tomorrow morning at 7 a.m. for epidurals. So if you need an epidural, I would come and give you one. If you have emergency surgery, well then I will come and give you an anesthetic.